Hello, folks. People have contacted me and wanted me to give them an update on my BBL surgery. So it's been 1 month that is post BBL by Spectrum Aesthetic um, Dr. Osak Omulepu. And although I'm not in as much pain as I was initially, there is some pain with, still trying to get adjusted with sleeping on my bottom. And, there's still some significant amount of swelling around the sides that still needs to come down. I'm still trying to work on that with massages. And yesterday I got a thermotherapeutic bath, which was, kind of relaxing and helpful. But just wanted you guys to see where I'm at. And this is quite swollen. I do want you guys to see this bookshelf here. And let's give you this side view. Hopefully you guys can see that. And go to the other side perhaps. And again, I'm still quite swollen even after a month, and very sore and tender. But whatever, it is what it is. You had surgery, and that's what comes with it, a little pain. I will say that if I had to do it again, I would, because you guys saw the pre-op pictures. But I don't know if I would use the same doctor. I have heard from other girls who've gotten the same procedure done, and although they had the same experience coming out of general anesthesia, I don't know that that was, super appropriate to be just thrown in the back of your car and left, almost for dead. In any case, the other thing is, whereas, I don't know if you guys have done your research, but whereas I've seen another doctor do it, and whereas they will just take the fat out of this portion. I mean, I don't know if you guys can appreciate, but my back is flat, and then you have this triangle area here. Most doctors kind of take the fat out and sculpt around the butt to make two big firm lobes. Dr. O had me use, I think he just filled in with fat, and then had me use a triangle. Where's my triangle? A homemade triangle padding to place here in order to, I don't know, push that fat, make that indentation there. And although I think it'll come out okay, but most doctors use their instruments in order to create that effect. So, I mean, the triangle after 1 month, I'm starting to drive again. It's very uncomfortable to wear. I did contact them, and they say they'll get back to you in 2 or 3 days. Well, I've yet to get an email back. And what I wanted to know was, am I supposed to keep the padding on when I wear my garment, and, the triangle? I've never got a response back, and that's why I say leave you for dead, because I took my own drain out, which most people would just go to their doctor. Because of my medical background, I don't have to do that. I just took the drain out myself, although it wasn't an easy task for me because I'm such a pain baby. I did manage to pull my drain out myself, but literally go to Miami, and I've spoke to four other people that had the same experience I did. You literally go to Miami, you get the surgery, you're thrown in the back of your car, goodbye. And so that's the Miami experience, is what I'm finding out. These are four different people, four different doctors, four different centers in Miami, and that's just the way they do it. So, if that's the business, that's just the business. I should have just been more aware of that. But when I do surgery, typically when people come out of general anesthesia, they go to a recovery room. They recover for a couple of hours. You make sure that they can put something on their stomach. They even get pain medications, and see if they can tolerate that. Make sure there's no complications. And then we send them home about 2 hours later. However, in Miami, apparently they don't do that. So if you're looking for that type of experience, you probably don't want to go to Miami, where it's a plastic surgery meal. Don't get me wrong, I'm not talking, negative about the situation. It's just what it is. So, don't be shocked. I was kind of shocked. Don't be shocked because, but when it's time for me to get my tummy tuck, I'll be right back in Miami. So, don't get me wrong. It just was a little shocking to me about how they do it down there. In any case, listen, my doctor did a great job because he had, you guys saw what he was working with. He had a tremendous task to do. And I mean, I cannot complain. Let me see if I can get this camera. Come on, camera. What we gonna do? I cannot complain. I mean, he has created curves where there was no curves. Okay. I do have a smaller waistline. Let's be real, I have a waistline, okay, where I did not have one before. So I am not complaining. He did, as much as he could do working with what he had. And as far as I'm concerned, he did do a good job. Me, I just, I'm looking for not perfection, but I want someone to be a little more detailed when it comes to what they do. And I've seen other procedures that he's done, and I mean that's his signature. His signature, but I just wanted mine. Probably would have wanted it more definition around here instead of having to put that brace, that triangle right there. So, and I don't know if other people, I know everybody has to wear that padding. It kind of gives you compression that's diffuse depression instead of you having maybe diffuse, pressure coming from the garment in certain areas where it can cut off circulation or cause ridges or bruises. So everybody wears the padding, but I don't know if everybody has to wear that triangle, which is problematic. So I wish that there would have been, more sculpting in that area as opposed to me having to, wear that triangle to force it. And so in that way, maybe a little more detailed as a person that's, a sculptor, professional sculptor in that area. I don't know. But in any case, he did a fantastic job with what he was working with. I do have a waist now. I do have hips now. I do have a big old badunk now. So, it is what it is. And that is my update. I'm still in pain after 1 month, which is incredible. I thought, this would be over and on to the next by now, but I still have a lot of thickening around my waist from the swelling. So I'm still working with that. Otherwise, you know, trying to get back to sleeping good, and that's a problem because all through the night, you know, I'm still not comfortable on my butt. So, I mean, my shoulders hurt, my arms hurt from trying to adjust and position myself throughout the night. But other than that, hey, it is what it is. Brazilian butt lift. The things women do for beauty. And I'll keep you guys updated. Thanks.